And one of the questions that just came up is if somebody's already on dual therapy, so let's say Humira and Imuran, or Remicade and methotrexate, should they stop the Imuran or methotrexate, and will that reduce their risk?
Yeah, so right now I'm not recommending that they stop it as far as contracting the disease itself. However, just to add on to what I said before, I think that if you happen to test positive for SARS-CoV-2 and you're on an anti-TNF, I would give you a holiday from your Imuran, your azathioprine, 6-mercaptopurine, they're all the same, or methotrexate, and until you've recovered from that. So I neglected to say that before.
Yeah, and that answers one of the other questions that we see here. Are we recommending coming off anti-TNF or methotrexate? And we really are not at this point. But I think that decision really uh, also speaks to, other risk factors, right? So myself as a pediatrician, I'm very comfortable starting an anti-TNF therapy with methotrexate because the numbers that are coming out in pediatrics of patients with COVID-19, almost nobody, I think nobody in the secure IBD registry, or one or two kids in the secure IBD registry needed to be hospitalized, and nobody died. So, can you speak to what risk factors you would think about, maybe coming off that second therapy?
Yeah, so I think it's really, really important. And when we segue into even starting therapy, our comfort level is probably different in different age groups, right? So as we and the secure IBD registry is showing similar data that it is in the general population. Your greatest risk is really over the age of 65, right? So if you look at secure IBD registry, you think age itself, the mortality rate is about 28% in the over 65 group, if I remember correctly, is sort of the cumulatively. So in those situations, we would, again, I think in starting, we would maybe pick one of these drugs that doesn't have a systemic effect, like Entyvio or Vedolizumab, which we'll talk about. And I would, depending on the disease state, when's the last time I saw them, et cetera, if you have an elderly patient, I think I'd be more willing to have the patient come off therapy, especially an immunosuppressant if they're still on it. That being said, drugs like azathioprine and 6-mercaptopurine, many of us are stopping those drugs when individual patients reach that age. And then there's the other flip side of comorbidity, which also comes into play when we're making these decisions, because that again sort of trumps risk of some of the medications we're talking about.
Right. So
And
things
just
like diabetes, asthma, and other things have been shown to increase your chances of bad outcomes of COVID-19, hypertension as well. So those are all, it's an individual decision that I think we try to make with the patient, and figure out what the risk and benefit of each of these drugs are.
and there's another really important question that came up is said if you stop taking Humira, and I think you could say the same for Remicade or the biosimilars, can you start taking again? And Jenna, just, if you kind of tell us a little bit about kind of these drugs are proteins and what happens to your body's immune system when you kind of start and stop. And
Yeah, I mean these are large proteins, antibody type proteins, and they're foreign to your body. Even though many of them are humanized or fully humanized, they're still not your proteins. And so, what your body tends to do, just like any other foreign exposure, is it will tend to remember that you've been exposed to this and form a special type of antibody that will be developed if you stop the drug and get re-exposed to it again. And when we call that process immunogenicity. And when that happens, a couple things can occur. You can be less likely to respond to the medication when you're exposed to it again because the antibodies that your body is making could destroy the medication. And the other thing is that in rarer occasions, you could develop some allergic type reactions as a result of that. So these aren't the types of medications we like to stop and start unless we absolutely have to. And for that same reason, is another reason why we sometimes will use these in combination with other immunomodulators, essentially to protect the antibody and to have some effect of the two drugs together.